Hi, I'm Alan Repke, Inform TV, and we're going to be talking Medicare a little bit with Mitch Odland right here in the city of Alexandria. Mitch, can you tell us kind of what you find on Medicare this past year, re-enrolling people?
Sure, yeah, thanks Alan. Well, the past enrollment season was a busy one. There wasn't a huge amount of change, but still these Medicare Advantage plans are the ones that are causing a lot of discussion out there and a lot of uncertainty. These Medicare Advantage plans, also known as Medicare Part C, they are very prominent, and a lot of people are enrolled on them, and they're good plans, but they are just very aggressively marketed. So a lot of people will come into me during the review time and they will just inform me about all the mail they're getting and all the phone calls, and they're confused is this a type of plan that they already have, or is this a type of plan that they should be interested in. So just the Medicare Advantage plans continue to be a product that is growing, but as it's growing and being more popular, it's just more and more confusion is out there.
And what about costs for our seniors, especially the people that are just coming in, that are turning 65 and will be going in for the first time?
Sure.
What did you find out that they need to be concerned about or understand with all the hype that we're getting on TV and radio?
Yeah, good question. A lot of people nowadays, or more and more people, are delaying their retirement. So they are working past 65 and they're continuing to be insured under an employer plan. So when that happens, people don't necessarily need to enroll onto Medicare at 65.
Oh, is that right?
Okay. Yep, people can delay it, and they can do so penalty-free as long as they maintain continuous insurance through an employer. So a lot of people, that's number one. So I tell people all the time, I say, just ignore everything you're getting as you're turning 65. As long as you are continuing to work and remaining insured on the employer plan, Medicare doesn't affect them at 65. The other issue is some people are retired, but they are not drawing their Social Security. And when they don't draw Social Security, then they're not automatically enrolled on the Medicare. But they want their Medicare because they're retired. They have no other insurance options. So in that situation, Medicare is not an automatic, and they do need to contact the Social Security office to enroll into Medicare only. They can continue to delay their retirement benefits, but they would want to enroll onto Medicare for their medical and health insurance. So that's kind of the trends I'm seeing right now on the enrollment side. As people are approaching 65, those two issues, I see that a lot. And then of course there's still people out there that are retired and turning 65 and already drawing Social Security, and they get automatically enrolled in Medicare. So those folks would expect to get their Medicare card automatically mailed to them 3 months prior to age 65.
Okay.
And it comes addressed by Social Security, and they get a lot of mail, but anything addressed by Social Security is very important mail.
And for the person that is on some type of medical plan where they work, should they also though be coming into you and seeing, would it be better to say no to the company plan? I know when I was working, there was people that were in that situation. They wanted to do that, but that was 10, 15 years ago, and they couldn't do it then.
Right. No, I mean, some people do, and I'm grateful for the chance to visit with people, and I certainly direct them and give them advice that's in their best interest. But there would probably be two reasons where some people would want to maybe jump off their employer plan and go on Medicare. I usually call it, they're just dipping their toes in the Medicare pool, and they're deciding if the water is warm enough to jump full on in. And there would be two reasons maybe to do that. Number one, if their employer plan not all employers cover the employees at 100%.
That's what I'm getting at.
Yeah, so there can be, even at 50% cost, the employee can have some pretty considerable premium expense. So, it would be justifiable to then go on Medicare because the premium expense wouldn't be any worse. It could possibly be a little bit better. That's one reason. Another reason is if that individual is currently going through any doctoring, some health issues that they are doctoring for, most likely on the employer plan side, they're going to have some considerable out-of-pocket in the form of a deductible and maximum out-of-pockets, whereas transitioning over to Medicare, they are drastically minimizing their out-of-pocket responsibility. So those two reasons, both very cost-effective reasons, would be to go on to Medicare and come off the employer plan. It doesn't mean they have to retire just by going on Medicare and coming off their employer plan. That's a separate decision of them deciding or not to retire, so they can still continue to work.
Now, you have today Blue Cross Blue Shield shirt on. I think that's what you have me covered by.
Correct.
And far as the main companies, we see some still advertising right now, but you can't go into a new program right now, can you?
Only under special circumstances.
That's what I thought.
Yeah, but there are people turning 65 all year long,
Okay.
and so I think that's where
see.
what's behind some of the
That's why
marketing.
they're marketing.
These baby boomers are out there.
Yeah.
And they're turning 65 every day in droves. So I think that's what's behind the marketing. But yeah, there's Blue Cross Blue Shield they are known as the #1 Medicare insurer in Minnesota.
Okay.
And they do a terrific job, in my opinion. Another carrier that's out there that I work with and I offer is Medica.
Okay.
They are also Minnesota based and do a very nice job as well.
Now, one of the things we see on some of these TV ads for you people that are soon going to be, or like me, been on it for quite a while, they promote dental, and in my situation, the policy I've had, I've asked you about medical or dental, but you said it wouldn't either do me any good because the premium would be probably more than it would cost. And tell us about the dental, because just recently I've seen that again ad on TV saying, hey, you can get your dental free even?
Yeah.
Tell us about that.
Yep, on these Advantage plans, they kind of tout all these extra benefits that they provide you above and beyond Medicare. Now, with a traditional Medicare supplement like what you have, Alan, Blue Cross Blue Shield doesn't pay for any of these services if Medicare doesn't pay first, but the Advantage plans can go above and beyond, and dental is a very valuable benefit for some of these people on these Advantage plans. You still have to expect some out-of-pocket costs. There's no dental plan out there that I'm aware of where you're going to just get 100% coverage for any of these services. But you can find some pretty valuable coverage on some of these Advantage plans. You can also go with a standalone dental plan through Delta Dental.
Okay.
And there again, like you mentioned, what I've talked to you about is, if you're going in 2 times a year, getting your cleanings, your oral exams, and some x-rays done, you're not going to go backwards by paying the premium, because the premium is approximately $500 a year.
Okay.
You're not going to go backwards really if you go in very regularly like that, and then at least you have the insurance for the unknown, like if you need a root canal or some bridge work or dentures, things like that. And oral health is very important. It's a topic I'm talking about more and more with my clients. As they age, they're having some oral health issues, and I know they're tying oral health to your overall general health more and more these days. So I know oral health is very important and a very key topic. So, when in doubt, if you have the disposable income in your budget, it probably doesn't hurt to take out a dental plan.
Now, as far as we have people watching out there on this that are 80 plus, or they're 45, 50, or 60 and got their parents getting to the point where, hey, the next move is going to be a nursing home. what do you recommend or find that these families or individuals should do if they're getting to the point where some type of assisted living or actually a nursing home? What do you do or recommend there, Mitch?
Sure. Yeah, that's a tough one, and the one common misconception with Medicare is that they cover long-term care services. And
that's what I'm getting at.
Yeah, they do not, of course. Medicare does cover skilled care in a setting such as a nursing home, but the skilled care is given to the person with the intent of getting them rehabilitated and back to independent living at home. So, that's always just a big risk that we all face as we age, is needing to be cared for by others in a setting such as a nursing home, and the only insurance out there that covers that is long-term care insurance, and that's very, very expensive, and you'd have to be approved. So if you get to the state where you'd qualify for long-term care, you might not get approved because you're already beyond that point. But and you just end up then going through the medical assistance side and working with somebody at the county, and then going to the state of Minnesota then would have a program, but unfortunately not until after you spend down a significant portion of your resources. But
now a case like mine, we've tailored the program that I took. Unfortunately, my bladder is shut down, and I have to have catheters 5 and 6 times a day. Mm-hmm. And so other people will be wondering, they either have diabetes or they've got high blood pressure or some form for medication that they need. What are you finding in the changes that you can offer the public as far as what prescription drug type thing?
Yeah, well, there's a big change to the Medicare drug model just this year due to some federal legislation. It was the Inflation Reduction Act. It was a big law that was passed a few years ago, and parts of that law were just enacted this year on the Medicare Part D side. So one of the biggest changes that was implemented was it put a $2,000 spending cap in place for people. So most people aren't going to hit that kind of out-of-pocket cost, but there is a percentage, I'd say between 5 and 10% out there, that their drug needs are that great, or they have drugs that are that expensive that they, even by paying 25% for these medications, their out-of-pocket can accumulate to the $2,000, and by doing that they go into the catastrophic stage much, much quicker than a person ever has done before. So it's getting better on the Part D side. Drugs are a big topic though, because of course with modern medical technology, they're coming out with all these new and improved medications, but they don't come cheap, obviously. There's a lot of research and development costs that go into these medications, so they are very expensive when they hit the market. So drugs are a very hot topic, but the good news is people are getting more and more protection year by year under Medicare for the cost of these drugs.
And for the most part, I was surprised my policy, I don't think, went up at all, did it?
No, your the drug policy or the Medicare?
Well, both. Maybe the drug portion went up here.
Yeah, there was a little volatility last year on the drug side. As far as the number of plans that were offered, a few plans were contracted here in Douglas County, so the offerings went from 21 standalone drug plans down to 14. And part of that was due to some of this change in the Medicare Part D laws. So some plans decided to either pull out of Minnesota or to offer fewer plans. But the plans that are offered, relatively speaking, the premiums did stay pretty level. There was some plans that made an important benefit change, and they went for example, a Tier 3 brand name drug. A lot of plans change from a copay to a percentage, so that's a little more open-ended for people, and they might end up paying a little bit more that way. But otherwise, the premium-wise, yeah, everything was pretty relatively stable, And your premium, I do know, stayed about the same, and your Blue Cross Blue Shield plan, I know for a fact, stayed absolutely unchanged. It's gone down 3 years in a row, and now it's stayed the same. So can never predict that it's gonna, keep doing that, but it's been a great plan, and I know it's covered you very well.
Now, people will ask, yes, it has, by the way, and people will be asking from a standpoint, did it go down because Congress put in more money, or they're originally charging us too much?
Yeah, it's based on kind of claims experience.
Okay.
I think the particular plan that you're on has a better claims experience than,
Okay.
there's another plan that Blue Cross Blue Shield offers, and I don't think it has the same claim experience as your plan. So that's how they kind of do it. They have to file these rates every single year with the state of Minnesota, and they have to justify if they're going to take an increase. They have to show, justify why they're doing this, and it's based, of course, on the number of, or the amount of claims that they pay out. So with your plan, I think it's just been a lower claims experience. People are maybe a little more healthy on that plan. I'm not sure, but thankfully it's been pretty stable.
Yeah, I've been very happy, and great service here, of course, from Mitch if I do have any problem. And I want people to understand out here, for the most part, I think, what is it, October 1st till the 15th of December, that's when you tend to see your clients.
Yep.
And that tends to take care of them, and the rest they just hand in their card at a hospital or a clinic or at a drugstore.
Yep. What most people's plans automatically renew, and that's again another misconception that some people they miss that, or they're notified by late September. They are all notified what their plan is doing for next year, and just by getting notification of what the premium is doing, it automatically means that plan is being renewed, and people don't have to lift a finger. They're going to automatically stay on it. Now, it is the one time a year, though, if people do want to come in and see if there's a different plan that would suit their needs. This is their one time a year to do that, guaranteed. And that specific time frame is October 15th through December 7th,
Okay.
so Pearl Harbor Day. But otherwise, there's actually pretty good stability in this market right now, and very rarely do we see plans don't get renewed. But of course it does happen, and there's a possibility that could happen. And when somebody doesn't get renewed, then they definitely need to take action.
And as far as a deductible, as unfortunately the older I get more age spots, and I've had a lot of skin cancer and a lot anhydrous where they burn spots off, so I look older every day. I look in the mirror, my goodness. And so from that standpoint, what are the people out there that haven't had any experience with Medicare yet? What will be a typical deductible that in this case I have to pay when I go to Centricare to Dr. Schoeneman there and takes care of my skin cancer?
Yeah, there's
every 6 months.
So the out-of-pocket when you doctor, traditional Medicare supplement plans, people going on Medicare nowadays have to be responsible for their Part B deductible. And I know you do on the plan that you're on. The good news is the Part B of Medicare deductible is $257 this year. So it's a very low deductible, and it's an annual deductible. So once you satisfy that on a supplement plan, most of the time the cost for any approved Medicare charge is pretty much eliminated. Now, your plan does have a couple of routine out-of-pockets, copay expenses. You copay, a small copay to go see a doctor, a small copay to go see the emergency room. But beyond that, if you need more extensive medical care, such as outpatient care, outpatient therapy, radiology services, inpatient hospital, durable medical supplies such as catheters, very, very good coverage, and you really should not expect any out-of-pocket.
And so in my case there, when I went in, I think it was the 24th of January to get my entire body looked at for spots and whatever. And I just recently received a bill from Centricare, and it said, well, you owe us $225.
Yeah.
And so what you're saying that, and I sent them a payment, and I think I've got to send them one more payment. But you're saying I probably should be caught up the next time I go to either the clinic for something,
Yep.
or back in July to get checked out again.
Correct. It's completely normal that you would see that kind of expense in January or the beginning of the year, because that's when the deductible starts over, is January 1. And so as people do their doctoring and begin doing their doctoring, that's when the deductible is usually satisfied. So it's completely normal, but then yeah, eventually at some point, and it sounds like maybe it's already happened, where you've met your deductible, a lot of this cost is going to get turned off for you then.
In my case now, I'm so-called probably in the middle of the road as far as active seniors that'll probably come in here and see you. What I'm talking about is the 75 to 85 or 75 to 90, and then compared to the 65 people, or the people that'll be watching this and wondering about things that are about to turn 65. What are you experiencing, or when they come in for their annual renewal, the two groups, above 75 and below 65? What tends to be the difference?
Yeah, the people below 65 are just looking for information.
Correct.
You know, it's so foreign to them, and like I said, there's a lot of marketing out there that's coming from all over the country, and it's causing a lot of uncertainty and unknown and confusion. So those people are just looking to get set straight, and they want to know what this is all about. So that's a very common appointment that I have for people who want to just come in and meet me, say hi. It's we just talk very, very general based educational information, and I kind of lay it out very, very simply for them. The people who are over 75, you know, who have been on Medicare, of course, they don't really have as many questions about how it works, because they've had, you know, experience using their Medicare. So then it just becomes a situation of what, you know, how has their health changed in the past year? Did they do more doctoring than they anticipated? Did they have some out-of-pocket expenses that they didn't anticipate? And it just we talk about, you know, finding the best coverage for them at the best price. And you know what, you know, everyone's budget is different, of course, and some people you know, can budget differently for things, but that's kind of how it works.
What tend to see here to come in on what is it, 1103 Broadway here,
Yep.
to see you right behind the Zimmy building?
Yep.
The people that are on a fairly good business, their company or their business that they own has good coverage, how many of those now are electing to stay on the company plan?
I'd say probably the majority.
They are?
Yeah, yep. I would say
Okay,
the majority.
that means the companies here have pretty good insurance then.
Yep, they do. They very much do. Yeah, we're very blessed in our community with some wonderful employers, mid-sized and large employers such as Douglas Machine and A-Guard, to name a few. You know, Alamere Hospital. So I would say, you know, the actual employee, the majority of them are just electing to stay on their employer plan beyond 65. Now, if they carry a spouse who's retired, maybe it makes sense for the spouse to jump off and go on Medicare early.
Okay.
So that's very common in that scenario.
Okay, that's what I was getting at, and then from a standpoint, still, if people, you know, we got a lot of tightwad, as in Alexandria, I call I'm a progressive conservative. Some of them are tightwad conservatives, and from a standpoint there, people still need to know, though, if you take just Medicare, all you're getting is hospitalization. Is that correct?
No, that's Part A of Medicare, is where you get the hospitalization. To complete Medicare fully and have what's known as original Medicare, there'd be another part called Part B.
Okay.
And that's called medical. And that's how the professionals bill for their services. So there's Part A and Part B. So those are the two parts that would make any individual eligible for a Medicare health plan that's available in their service area. Medicare A and Medicare B is a wonderful program, but there's still out of pocket, so that's why a lot of people do seek out these other Medicare health plans that are out there to help with their out of pocket expense. Medicare Part A is generally zero premium as long as a person has paid into the Medicare system through their payroll taxes, Medicare taxes for a minimum of 10 years. Then Medicare Part A would be zero premium, but Part B has a standard premium, and it's based on income. The majority of people who don't have a low income or too high income pay the standard premium of $185 a month. And that is the going rate typically that we see for that. And then beyond that, then we get into Medicare Advantage plans or Medicare Supplement plans. Those are basically the only two roads a person can travel down in Douglas County right now if they want extra protection, a Medicare Supplement like what you have, or these Medicare Advantage plans.
And some of those folks, actually, no matter what they need, they pay nothing after that?
Well, Medicare Advantage plans do start at zero premium.
Because we hear that on TV and people talking in a church basement or a bar.
Yep, they are legit. All four carriers that offer Advantage plans in Douglas County do offer a plan that has zero premium. And it's zero deductible as well. Now there would be out of pocket in the form of a cost share, such as a co-payment or a co-insurance. And that out-of-pocket has limits. There's an annual limit, maximum limit that is set on a member's out-of-pocket. So, but then the supplement side, you're looking at, a very good supplement cost, which would be the plan that you're on in 2025 would cost $178.05. So that would be the cost
per month.
Per month that you'd be looking at adding on top of the Medicare Part B premium cost. So you'd be looking at bringing your premiums up a little bit, but then you would be bringing your out-of-pocket substantially down when you doctor.
But that would tend to be for the individual out there that takes quite a few drugs or tends to have more medical issues than I have, or not? Or they just want to make sure they don't have some runaway costs that come along?
Yeah, those are the people that just want maybe a little more peace of mind for the unknown, because with a supplement plan you kind of know what you're paying at the beginning of the year. And so no matter what doctoring comes your way throughout the year, there's fewer surprises that way. So people are they're the type of person that says, this is what I want to budget for. I'll have this in my monthly budget all year long, and then that way they expect far fewer surprises that way.
Well, Mitch, I think we've given our audience a pretty good understanding of what they need to be thinking about, and the opportunity to come in and talk to a true professional like yourself. Do you have any other closing or anything as far as where you're at and what you can do for people?
Yeah, no, I thank you for your time, Alan, and thanks for letting me have a chance to visit and share some of this information out there. No, if anybody is turning 65 in the near future and just wants to come in and visit with me and have a discussion, and I can give them some information and they can meet me, that'd be wonderful. 1103 Broadway is my office. I office in the Zimney building. You can park in their parking lot. My phone number is 762-6565, and I have a website, odlandins.com, where you can schedule an appointment that way as well.
That sounds good, and we encourage all you people to think about what we talked about here, and go Cardinals. They're in the big game coming up.
Yes, you bet. Tomorrow, big game.
Okay, thanks for watching, people. I'm Alan Repke, Inform TV.